Do you have a stiff, sore, or achy back after sitting at your desk all day, after driving kids around in the car, after swimming, after being on your bike for a while, or just because of the stress life gives you and that's where you carry your tension? Here at West County Spine and Joint, we use a treatment modality called cupping therapy to help relieve a lot of those tensions. Let us take you through a sample treatment. The first thing we do when using cups is take a little bit of some muscle cream and lotion and apply it in the area so that it's more comfortable on the skin. And then we will have already gone through an exam to figure out where exactly each patient needs the cups placed. And in this patient, he has been on his bike quite a bit lately, and so we'd like to reduce some of the tension up top from being in that arrow position. When we first put the cups on, we use a suction device and come up with a few pumps. That creates a negative pressure underneath the cup. In comparison to, say, a deep tissue massage, where we are compressing the tissues beneath, with cupping therapy, we are using a negative pressure to relieve stress and bring more blood flow to the area. As you can see with the cups that are on, we are getting a lot more blood flow in, which is giving you that red purplish color. We are pulling the skin and then the fascia under the skin and the muscle underneath that up into the cup. Many questions we get are first, oh my gosh, that looks wild. Is that going to hurt? And the short and long answer to that question is yes and no. It, similar to Graston technique, doesn't feel like a lovey-dovey massage, but should not be anything where you are squirming or feeling too uncomfortable. 9 times out of 10, the first about 30 to 60 seconds the cups are all on, it feels a little funky. Then as tissues start to give in, more blood flow goes through the area, that pressure is relieved and it is not uncomfortable anymore. A typical treatment will last anywhere from 2 to 15 minutes, depending on the root problem we are treating. And when we take the cups off, most patients will have some discoloration, or what we like to call little pepperoni pizzas or little octopus bites. So I'll show you. We pull up, the vacuum is released, and the cup comes off. And as you can see, just after the 35, 40 seconds these cups are on, there are little red marks. The difference from person to person in how discolored we get after cups is pretty individual. Some look mighty colorful and some an hour later don't look colorful at all. It is not the goal of treatment to make you look colorful or bruised, but oftentimes it happens because we are increasing that blood flow. A typical treatment plan for an acute issue would be that we would treat this every 2 to 3 days the first few weeks. And then after that, once a person stabilizes, they might choose to continue treatment on a somewhat regularly irregular basis of once a month, once a week, whatever works best to keep those tight stress spots much looser so that quality of life improves, range of motion is better, and overall circulation of blood and fluids through body is improved. Here at West County Spine and Joint, we rarely utilize just one treatment technique for either muscles or to adjust the joints of the body. And typically in a situation like this where a patient has a lot of upper back, neck tension, we probably have some restrictions in the middle part of our back and spine as well. So we will use commonly chiropractic adjustments along with cupping therapy, and also suggesting certain exercises for you to do at home, because we know that if we have a handful of different stretch exercises to do at home, the treatment that you receive in office will be more effective and have a longer lasting effect.